Hi, welcome to the very first episode of The Future Tense, where we dive into the latest developments in health, science, development, and innovation through engaging and insightful conversations. I'm your host, Paul Adepoju. I'm a scientist turned journalist and communications expert with vast and robust reporting experience in science, health, tech, development, and their intersections. Today, we have an exciting and hopeful topic to discuss. New Zealand's coalition government has recently announced a significant expansion in funding for cancer treatments. This initiative will enable Pharmac, the country's drug buying agency, to introduce 26 new cancer treatments as part of 54 new medicines. The announcement has been warmly welcomed by the Cancer Society of New Zealand, with Dr. Rachael Hart, the Society's chief executive, describing it as providing new hope for cancer patients who have long awaited access to cutting-edge treatments. Today's episode features two esteemed guests who played pivotal roles in this transformative initiative. Dr. Shane Reti, New Zealand's health minister, will provide insights into the government's strategy and the expected impacts of this funding boost. Additionally, Dr. Rachael Hart, Chief Executive of the Cancer Society of New Zealand, will share her perspective on what this means for cancer patients and the ongoing efforts to improve cancer care in New Zealand. This conversation stems from a story I worked on, which has now been published by The Lancet Oncology. You can find the link to the article in the episode description. So sit back and join us as we delve into this groundbreaking development that promises to change the landscape of cancer treatment in New Zealand. Let's start the discussion with New Zealand's Health Minister, Dr. Shane Reti. Thank you for joining us, Honourable Minister. Let's jump right into it.
Yes, so a quick question I have is how do we add these other elements that are important for individuals living with cancer so that they are not just getting the treatment, but they are also able to access other required services like psychological support, palliative care, and others. So what is being done to also expand it beyond treatment?
So part of the overall package is not just the procurement of what is a transformative package of cancer medicines, one of the biggest injections, if not the biggest injection into our pharmaceutical procurement agency for cancer ever. But part of what has also taken time is the implementation following that procurement. And that includes things like the infrastructure around the procurement, the ability to have infusion sets, the ability to have the laboratory, the ability to have the radiology, and then, as you're saying, the ability to have the emotional and social support as part of this procurement package. I put all of that into the infrastructure required to deliver the whole package. So all of that has been worked on.
So another quick question I have for you has to do with the prioritization of cancer in addition to other health priorities. How do you ensure that while you are not, your government is ensuring that other health conditions also get increased funding?
So we have prioritized cancer through several ways. First of all, in our government policy statement, we prioritize, cancer as one of the 5 key pathological systems that we'll be prioritizing. And secondly, as one of our 5 key health targets, the faster cancer treatment, which requires management within 31 days of diagnosis or a plan being established. So in several parts of the guiding framework for health, we have established cancer and cancer management as being a high priority.
There is also an element of supporting research and innovation. How quickly do you think updating protocols and introducing new tools to improve the lives of cancer patients in New Zealand, is there anything your government can do to also improve this?
So the research that accompanies such a large injection is a byproduct of the policy initiative, not the purpose of the policy initiative. And as a separate body of work, I've been working with the Ministry of Health around how we can increase our participation and contribution to clinical trials. And one would hope that as a part of this package and the widening access to 175,000 people and the increased cancer treatments, the further 26 cancer treatments that we will fund, that creates further opportunities for research and certainly for clinical trials.
Yes, thank you very much. What of other interest groups that would want to attract similar attention from the government? How ready are you to convince them that the government resources is very finite, even though health needs are unlimited?
So I think it's apparent that it is a restricted budget that we have walked into. But having said that, we have very clearly signalled here that cancer is a priority for us. And in fact, the government policy statement will identify the range of other high priority modifiable behaviours, organ systems and targets that we'll be applying ourselves to. So the government direction will be very clear on that, and cancer is one of those.
Do you have any last words for me before I let you resume the rest of your day?
Just that we're very pleased with this transformative, substantive increase to our pharmaceutical procuring agency, and are excited for the 175,000 people in year one who will benefit from this injection, and looking forward to working with our collaborators in the cancer space and those around the cancer space for how we can get maximum effectiveness, maximum benefit, maximum reach from this injection.
Thank you, Honourable Minister. And I've just been joined by Dr. Rachael, who is the Chief Executive of the Cancer Society of New Zealand. So I will continue the conversation with Rachael.
Then I will pass the relay baton over to Rachael. Leave it with you, Rachael.
Thanks, Minister.
Okay, no order, my thanks, Paul.
I'm guessing you are always in touch with one another, right?
We do know each other, yes.
We certainly do.
Okay.
Yeah.
Yeah, thank you very much. How are you doing, Rachael?
I'm well, thanks, Paul. What about you?
I'm doing well, thank you. What can you tell me about what went into this particular announcement? I know you represent a professional society and you're not expected to be partisan, if I'm correct. So what input did the professional organizations have in this major announcement?
Yeah, well, we've been pushing for a long time for reform to Pharmac, which is the New Zealand drug buying agency, both to be more transparent and faster in how it approves and then funds medicines. And then in specifically wanting more access to cancer drugs. The government had promised specific drugs, 13 specific drugs prior to the election, which we supported the input into cancer drugs. But after the election, they weren't in a position that they were able to say how they would fulfill that. So we and many others in the sector and people with cancer and clinicians all started talking to each other, talking to the media and saying the government's promised this, and so we want to deliver it. And it's been very successful in raising public awareness and in helping the government realise how much of a priority this is.
Yeah, quick question. Does it bother you that health issues, getting government's attention to health issues still has to heavily rely on public, on raising the awareness among the public, and not getting to a system where things are automated, the government knows the priorities and everything runs smoothly without the active mobilization and public engagement?
Yeah, I think it's a great question, Paul. I mean, health is hugely complicated, and we could spend 100% of our GDP on health, and we just tip the surface of what we need. So we do recognise that the government has to make choices. I think that there is a role for advocacy organisations to help governments make the right choices, to say what's important. And I hope that increasingly we'll see a role for the private sector as well to actually help solve some of these issues. So I'm not, I'm not adverse to organisations like mine talking to the government about what's needed, but I do think once governments make promises about what they're delivering, they do need to deliver on them.
Yeah, absolutely. So how will you describe the current top cancer priorities for New Zealand, and what is high in your priority advocacy list?
Yeah. Well, I guess we think about it in 4 different areas. So the first area, of course, is prevention. The best cancer that you can get is the one that you don't get. And so New Zealand has a history of very strong public health laws. We were excited about tobacco legislation that was coming in. Unfortunately, that's been removed, but we still want strong action to stop people smoking, particularly young people picking it up, and also on alcohol and nutrition to improve that. We want better screening. So if you are going to get cancer, the best thing for the health system and the best thing for you as a patient is to catch it early. That gives you your best chance. And so New Zealand has relatively good screening. We've got the five major screening programs. We want to introduce a lung cancer screening program in New Zealand, and to extend the age range of bowel cancer and breast cancer, and also fully fund cervical cancer. When it comes to kind of the treatment pathways, helping people actually get to treatment is really a big thing. The government has made a big announcement that will help people access transport and accommodation near treatment, but just other financial help and that sort of thing. And then the wraparound services around cancer care. So as well as the treatments that we will continue to push for, just the wraparound support that people can access through physiotherapists and nutritionists and all of that sort of thing, that help people either live with or beyond cancer, but to live good lives.
So what we describe as the society's official position on the government's announcement, and how do you still think this can be better implemented, since we know this promise is being made against the next budget?
Yeah. Well, I mean, we're really excited about this announcement. This has been a long time coming, and to see the increase not only of the 13 medicines that the government promised, but an additional 13 cancer medicines, as well as the 28 beyond that, is just really exciting for us. So that's our top line. We think we got into this situation because our Pharmac, our drug buying agency and the system around it just isn't fit for purpose. So we want improvements to Pharmac. We want continued increases to the budget. But we also want the government to have a medicines strategy to guide investment and make sure we don't end up in this situation in future.
Yeah, talking about the future-proofing this announcement and this development, what is the realistic way forward to future-proofing cancer promises, considering governments coming and governments leave? The government will come in, there will be a new priority for that government. We could have another global health, public health relevant development like COVID that may want to divert national resources elsewhere. So what is the realistic way to ensure that this is sustained, improved, expanded, and we don't have to come back to this point in the nearest future?
I think there's firstly just, it's really important to be data driven. because if you're data driven and you say this is the thing that's going to make the biggest difference, then the next government coming in can't argue that, it can't argue with that. So that's a really big thing. I think it's having community support. Making sure that we're actually speaking about things that are relevant to people and that people care about. They care about medicines. They care about cancer patients. I think then also having strong agencies. So in New Zealand, we had almost 5 years ago, the Cancer Control Agency set up. So that helps with being data driven, with leading system change. I haven't seen any government not want to do good for cancer, because it's such a big issue. It touches so many people. It's such a big cost within our health system. So really it's helping those governments make the best decisions, rather than having to fight for it in the first place.
So in reality, if I get you right, you are saying that your job is actually easy because any government by default in New Zealand would actually want to do something good regarding cancer. How did
they just don't want to spend money doing it.
How did New Zealand get to that point where it has become so basic and almost a requirement every government to do good regarding cancer? And this could be a learning moment for governments elsewhere, that cancer agencies and societies like yours still try to convince the government to do something. So how did New Zealand get to this point?
Well, I think we first have to recognise New Zealand's in a very privileged point, that some of the diseases that are prevalent elsewhere just aren't in New Zealand. So some of the urgency of the health systems that other countries are dealing with, New Zealand doesn't have to deal with. I think, though, I think there's historically been a very strong voice in New Zealand for cancer. I'm proud to represent the biggest cancer organisation in New Zealand, and I'm proud that our voice is definitely part of that. I think also just knowing that everyone is touched by cancer. There's no one I talk to ever that says, "Oh, I've never heard about that," or whenever I talk to people, they tell me about their aunts or their sisters or their mums, or their kids, and so I think, I think there's a really strong moral case. I also think there's a strong economic case, though, because cancer is such a cost to the health system. So doing everything we can to reduce that cost is going to be, is the right thing for a government to do.
Yeah, if I would take you back to something that I said, which is the best thing is the cancer you are not having, which is prioritizing prevention. But how will you rate that journey so far in terms of what can be done and what is actually being done regarding cancer prevention?
I think we've still got a long way to go. I think prevention is something that governments are less likely to prioritise because it's harder to. It's not as emotive, to say, that we've stopped people from getting cancer rather than we've supported those who have. As I mentioned before, I think really in the tobacco space, New Zealand has a goal to be smoke-free by 2025. I don't think we're quite going to get there, and we're certainly not going to get there for our most vulnerable populations, including Māori and Pacifica populations. And so I think that really does need to stay a focus. Where we would like more action on alcohol control. Not many people in New Zealand know the connection between alcohol and cancer. So we need to keep the pressure on.
So, okay, let's wrap it up. So any last words for me? Any thoughts? What are your last remarks for me?
Yeah, look, I think it is an exciting moment for New Zealand. But when it comes to drugs, New Zealand is a long way behind a lot of comparative countries. So this is only, really scratching the surface. It will get us, what's considered kind of standard of care everywhere else in the world. Not everywhere else, but in many countries in the world. It is a good news story, but it points to the need for continued system review.
That was really, really beautifully said. Thank you very much, Rachel. Thanks for accepting my invitation. And I really enjoyed having this conversation with you. Please keep in touch when there is any development in New Zealand or global health that I think is of relevance to New Zealand.
Yeah, thanks, Paul. Bye.
That brings us to the end of our very first episode of The Future Tense. I hope you found our conversation with Dr. Reti and Dr. Rachael Hart as enlightening and inspiring as I did. Their insights into New Zealand's expanded funding for cancer treatment highlight a promising future for many patients and underscore the importance of continued investment in health innovation. If you'd like to read more about this topic, don't forget to check out the article I wrote, now published by The Lancet Oncology. The link is available in the episode description. Thank you for joining us today. Be sure to subscribe to The Future Tense on your favorite podcast platform so you never miss an episode. We'll be back soon with more stories that brings you to the forefront of health, science, and innovation. If you enjoyed this episode, please leave us a review and share it with others who might find it interesting. Your support helps us reach more listeners and continue bringing you quality content. Until next time, stay curious and keep exploring the wonders of health and science. I'm Paul Adepoju, signing off.